What's going on, world? Hey, welcome. You guys already know what the deal is. We are doing NCLEX questions. All right, if you guys are just now joining, my name is Kevin. I am a registered nurse. I've been a registered nurse for almost 4 years. It'll be 4 years in June. I did 16 years in the Navy, and I've been a master instructor for almost 10 years. So you guys already know what we're doing. Hey, I need 100 people, and I need 1,000 likes. I need both of them, or we're going nowhere. All right? Hey, make that happen. What's up? Hey, as everybody starts to come in, make sure you guys smash that like button, you guys share, and you guys follow. I need 1,000 likes, and I need 100 people up in here, or you don't get no questions. All right? I got these questions for nurseslabs.com. They are free sets of questions. You guys can go over there and you guys can check those out for yourself. On Monday, I did some case studies. So now we're going to switch it up and we're going to do something else. All right? So I want to know who you are, where you're from, where you're at in your nursing journey. If you have any type of questions regarding, nursing NCLEX, hey, but we're going to be doing questions. So like I said, I need 100 people. I need 1,000 likes. And I want to know who you are, where you're from, and where you're at in your nursing journey. Jess says, did a mock NCLEX RN LVN in the Rio Grande Valley. Shout out to the Valley. I've been down there once or twice. You know what I'm saying? Harlingen mostly. But I've been to McAllen. I've been to Brownsville. I've been to... what's some other ones that are down San Bernardino? I've been to a couple spots down there, you know what I'm saying? So shout out to 135 people. Hey, but I need 1,000 likes. Hey, I need for y'all to get carpal tunnel for me right now. Make it happen. Oh my God, I'm in nursing school in Harlingen. Hey, I may have been to Harlingen maybe once or twice. I'm just saying. Hey, I got 162 people up in here. Make sure y'all smash that like button. We need 1,000 likes. 1,000 likes. I got some questions to give y'all. Got at 100 and something people. If y'all give me 100 likes, that's like 17,000 likes. Did I do my math right? Don't even matter. So it says I've been having high assessment results. Is that good enough for that NCLEX? Should be good enough. But once again, it all really just depends on you. All right. Know thy enemy, and you know what the enemy is, and it's the NCLEX. If you're prepared, you understand how to break down NCLEX style questions, you're not going to have a problem. My pending is May 2nd, 2 more weeks. Hey, that's what I'm talking. Is it Cheyenne? Shout out to you, Cheyenne. You're going to rock that. All right. Well, here we go, ladies and gentlemen. We're going to be doing questions. Once again, I do them every Monday, Wednesday, and Friday at 5:30 Central Standard Time. And if you're not here in the United States, that's, Texas time or anything in the Central United States. All right. It says the enemy is myself. Hey, if you know the enemy is yourself, you better get out of your own way. All right. But here we go. Question number 1. After exposure to hot weather and sun, clients with signs and symptoms of heart-related ailments rush to the emergency department. Now, I want you to put in the specific order. Who are you going to see first? Now, I want you to sort the clients into those who need critical attention and those who have less serious conditions. All right. So is it a comparatively healthy housewife who states that the air conditioner has been down for 5 days, who exhibits hypotension, tachypnea, perfused diaphoresis, and fatigue, an elderly traffic enforcer who complains of dizziness and syncope after standing under the heat of the sun for several hours to perform his job, a sportsman who complains of severe leg cramping and nausea and displays paleness, tachycardia, weakness, and diaphoresis, and an abandoned person who is a teacher, has altered mental status, weak muscle movement, has hot, dry, pale skin, and whose duration of heat exposure is unknown. What's up, Gene? How are you? Sherry? Oh, wait, Sherry. I know Sherry. Where you at? Where you at, Sherry? I saw it. Where you at? There it is, Sherry. Hey, first of all, Sherry, congratulations to you. Welcome to the greatest shit show on earth, known as being a nurse. Sherry, you let me know that a long time ago, so I appreciate you. So if you could give a piece of advice to everybody here, what would it be for them preparing for their NCLEX? And once again, congratulations to you. Nurse Amber, a.k.a. Nurse Glamber, our other NCLEX strategist, she is one of the homies, and she also does NCLEX coaching as well. If y'all are not following her, I don't know what you are doing with your life. You need to get it together. Dr. Awesomer says BCD or B. Oh my God, DBCA. That dyslexia is really hitting. Rachel says BC or DCBA. Okay. You're taking your NCLEX in 2 days. Is it CTA Mayo? Shout out to you. What's up? Is it Nasiri? All right. What else we got? Hey, if you guys are just now joining, we are doing NCLEX questions. I got them off nurseslabs.com. They are free sets of questions. You guys can go over there and check them out for yourself. I need for you guys to smash that like button, share and follow. Hey, we're on the road to 10,000 likes. If I don't have 10,000 likes, hey, my voice hurts. My voice hurts. All right. So here's our answer. The answer is D, B, C, and A. So first one is the abandoned person. The abandoned person has symptoms of heat stroke and medical emergency, which heightens the risk of brain damage. The subsequelae of the insult may persist beyond the initial CNS dysfunction, involving injury to the gut, kidney, skeletal muscle, and or other organ systems. The elderly traffic enforcer is at risk for heat syncope and should be instructed to relax in a cool environment and withdraw from approaching related circumstances. All right, the sportsman is experiencing heat cramps, which it can be treated with rest and fluids. All right, and the homemaker is having heat exhaustion, and management involves IV and oral fluids and settling in a cool area. So that is the correct answer, right? That be the correct answer. All right. By the way, these are off nurseslabs.com. The one thing I'll say is to take nurseslabs.com. Although they are free sets of questions, you guys can take them with a grain of salt. All right. They are very helpful while you're in nursing school, and they have been proven to help for NCLEX, but you want to get you something a little bit more. So if you're one of those people who are looking for good sets of questions, Nurse Amber, she recommends UWorld. I recommend Archer because their questions are relatively good with regards to the NCLEX. All right, here we go. Question number 2. The ambulance has transferred a man with severe chest pain. As the man is being transferred to the emergency stretcher, the nurse assessed the following: unresponsiveness, cessation of breathing, and absence of palpable pulses. Which of the following tasks is proper to assign to the nursing assistant? Is it aiding with oral intubation, performing chest compressions, placing the defibrillator pads, or starting bag valve mask ventilation? Now think about this. The UAP, what is their scope of practice? What is the scope of practice for a UAP, unlicensed assistive personnel? That is what a nursing assistant is. All right. That is what a nursing assistant is. All right. So what do you think is the right response or the right task for the UAP? Everybody's telling me we got some B. Okay. What else we got? Hey, if you guys are just now joining, we're on the road to 10,000 likes. Make sure you guys smash that like button. You guys share and you guys follow. All right. That is the trifecta that gets me to the For You page. So don't be greedy out here. All right. 10,000 likes. Smash that like button. Get carpal tunnel for me. Hey, and if you're new here, I want to know who you are, where you're from, and where you are at in your nursing journey. All right. We have a bunch of people saying B. So let us see what the answer is. Well, first off, I usually put y'all on a timer, so let's see what the answer is. Here we go. Here is our answer in 3, 2, and the answer is B. You want to perform chest compressions. Basic cardiac life support is learned by nursing assistants, so they can perform chest compressions. Certified nursing assistants deal directly with the patient, so they must be cardiopulmonary resuscitation certified. It is the nursing assistant who witnesses the victims of cardiac arrest and becomes an immediate responder. A trained certified assistant can easily cater the instantaneous need of the patient. All right. That is why answer choice B is the correct answer. So if you pick A, C, or D, make sure when you do that, you go back, you read your rationales. You go back and you read your rationales because your rationales solidify the answer. Sherry, thank you for the heart me. I appreciate you. All right. So if you didn't get that right, make sure you read your rationale, circle back, get that content. OK, here we go. Question number 3. A high school student comes in to the triage area and ambulatory and his uniform is soaked with blood. He and his classmates are saying we were running around the outside of the school and he got hit in the abdomen with a stick. Which statement should be a priority? What is the very first thing? What is the thing that creates instability, something that's unexpected, or something that the patient's going to die first, right? Priority. What do I want to do first? The very first thing. The stick was absolutely filthy and muddy. He and his family, or he has a family history of diabetes, so he requires attention right now. He pulled the stick out because it was too painful for him, or there was plenty of blood, so we used 3 gauze. What are we thinking? Everybody's telling me C. So shout out to everybody who's just now jumping in here. Hey, so just a quick reminder, I am doing a 3-day live NCLEX review. I'm going to tell you an NCLEX story. We're going to take it from beginning to end. We're going to tell you about what the test is all about, how the test grades you, all the way to answering NCLEX style questions. All right. So if you guys are interested in that, you can check that link in my bio, or you guys can go to thebootnurse.com/3-day review. Got a few spots left. So make sure you guys go over there and check that out. It says I had a lot of these type of questions, priority, and who do you see first? Management of care is the largest section on the NCLEX at 15 to 21%. 18 to 23%, doesn't matter what it is, it's still the largest section, okay? So that's cool that you got all those because that's what nursing is all about. All right, but the answer is C. He pulled the stick out because it was too painful for him. An impaled object may be given a tamponade effect, and removal can result in abrupt hemodynamic decompression. Surgery is often required. Impaled objects are secured in place so they do not move, and they should only be removed in the operating room, right? So essentially, the stick is inside the body and it's stopping him from hemorrhaging. Once you pull it out, now whatever was stopping him from hemorrhaging is gone, so now he's going to hemorrhage all over himself, essentially, all right? So think about it. Stick in, good. Stick out, now it's bad, all right? So now he's going to perfuse all over the place and he could die from hypovolemic shock, okay? So if you got that answer right, make sure you circle back. Make sure you circle back and you guys get that content. You guys get that content, all right? Here we go. Question number 4. A mother is so worried that her son took an unknown amount of children's chewable vitamins at an unknown time. While in the emergency department, the child is alert and asymptomatic. What information should be directly stated to the physician? All right. So it's based off of the level of importance and the fact that you have a child that took, I don't know how many amounts of Flintstone vitamins, because that's usually what it is, right? So is it A, the child was nauseated and vomited before arriving at the ER or the ED? I'm sorry. The child has been managed multiple times for unexpected injuries. The child has been treated many times for ingestions of toxic substances, or the ingested chewable vitamins contain iron. What are we thinking? Oh, she's screaming. Is that Robin? Robin, is that you? Robin telling me D? If I got your name right, oh, I'm going to be so proud of myself. Yes, that's what I'm talking about. Shout out to you, Robin. Robin is telling me D. All right, cool. Got you. So Sam is saying D. User 61 is saying D. Chella is saying A. All right, shout out to y'all. Hey, if you guys are just now joining, we are doing NCLEX questions. It says, I accidentally overtook iron. Oh, you accidentally overtook iron, huh? Tell us what it did to you. Oh, if you are new here, I want to know who you are, where you're from, and where you're at in your nursing journey. Make sure you guys smash that like button. We're on the road to 10,000 likes. Hey, if we get to 10,000 likes, if we get to question 10, and if I don't have 10,000 likes, I guess we're just stopping at 10 questions today. So, and the answer, of course, is D, mostly because Robin overtook some. But the ingested child's or children's chewable vitamins contain iron. Iron is a toxic substance that can lead to severe bleeding, shock, hepatic failure, and coma. The antidote that can be used for severe cases of iron poisoning is it deferexamine? Deferexamine. There we go. Deferexamine. Iron poisoning is one of the most common toxic ingestion and one of the most deadly among children. Failure to diagnose and treat iron poisoning can have severe consequences, including multi-organ failure and death. All right. These are all management of care questions, ladies and gentlemen. You need to know what to do. Management of care, medical emergencies for physiological adaptation, they all go hand in hand, okay? So if you don't understand these things, circle back, get the information, and keep doing your questions, all right? Here we go. Question number 5. Several clients arrive in the ED at the same time complaining of abdominal pain. So designate them for care in order of the severity of their condition. So who do I see first all the way to who do I see least? You're going to use every single one of them, A through F. It's going to take y'all a minute, okay? So a 42-year-old woman with moderate right upper quadrant pain who has vomited little amounts of yellow bile and whose symptoms have worsened over the past week. A 68-year-old male with a pulsating abdominal mass and sudden onset of tearing pain in the abdomen and flank within the past hour. A 53-year-old who experiences discomforting mid-epigastric pain that is worse between meals and during the night. A 38-year-old man complaining of severe obstructive or occasional cramping with 3 episodes of watery diarrhea hours after meals. A 12-year-old girl with a low-grade fever, anorexia, nausea, and right lower quadrant tenderness for the past 2 days. And a 25-year-old woman complaining of dizziness and severe left lower quadrant pain who states she is probably pregnant. What do we think it is? Put them in order. E, B, D, C, A, F. Cool. Who said that? Rachel. All right. Hey, if you guys are new here, welcome. We're doing NCLEX questions. All right. I want for you to put these in order. Put them in order. Priority. What else are we thinking? I'm going to give y'all some time, so you guys take your time. Uh-huh. All right, what are we thinking? What are we thinking? Dr. Awesomer says B, E, F, A, D, and C. Ani says E, just E, huh? You got to give me, you got to put them in order. B, E, F, A, D, C. Okay, B, A, or B, F, A, E, C. Awesomer, why are you telling me B? You just put a whole bunch in there. B's got a AAA. Do they? Are you sure? Well, let's see what the answer is. Let us see what's up, Queen? How are you? Here we go. So it's B, F, E, A, D, and C. So you are correct. Definitely B has a AAA for sure. All right. You guys can look at those. I'm not going to read them all. I know that makes it look kind of small. Does that look kind of small to y'all? Maybe I'll shrink it down some. Or here what I'll do. Blow it up. Nope. That's not good either. Let's back it up. Let's back it up. Back it up. It says I can't read the screen. Open your eyes, Sherry. I'm just kidding. I don't know why these are so small, but I just tried to enlarge it. And it doesn't help if I do it that way. All right. So shout out to everybody that got that right. So it's B, F, E, A, D, and C. It says E something something. E, A, D, and C. All right. So definitely the first person you want to see is that person who is experiencing an abdominal aneurysm. All right. An abdominal aneurysm that may rupture and may abruptly deteriorate. That is terrible. My ADHD gave up on that one. Hey, I don't need your ADHD to give up on this, and I don't need your ADHD to give up when you're actually taking the exam. OK, I don't want that. But ladies and gentlemen, hey, I got a couple things that's going on. Right. Hey, if you want some free test taking tips, you guys can go over there and check that out. That link is in my bio, thebootnurse.com/test. Also, I have an ebook, right? You guys can go over there and check that out. It's over 700 pages of greatness. That'll definitely get you over that hump to passing the NCLEX, because remember, conquering the NCLEX begins with you. My man James is in the building. Hey, if anybody ever wanted to know how to do a side hustle, hey, my man James, business mentor. He's a homie. He's he's a great friend. So if you guys are interested in that, make sure you guys go over there and follow him. 7-day NCLEX course, ladies and gentlemen. If you are looking for an NCLEX course, right, you can join it for $7. $7 for 7 days. That's the trial. After that, if you don't like it, you can cancel it, or you can stay and you get charged subscription, $97 every month. Or if you're one of those people who have failed multiple times and you don't know where to begin, you don't know where to start, you don't have any grasp or concept of content and NCLEX style questions, and you want me to cut out all the fluff and put you on the straight and narrow, I can do that too. And I do that with coaching and mentoring. And if that's something that you're interested in, you can check it out at the website at thebootnurse.com/coaching. All right, here we go. Question number 6. The newly hired nurse is in his first week on the job in the ED. He used to be a traveling nurse for 5 years. Which area in his present job is the most appropriate assignment for him? Is it fast track clinic, pediatric medicine team, trauma team, or triage? What are we thinking? Y'all better get that ADHD together. Hey, if you guys are just now joining, we are doing NCLEX questions. Got these NCLEX questions from nurseslabs.com. They are free sets of questions. You guys can go over there and check those out for yourself. All right, you guys can go over and check those out for yourself, okay? What are we thinking? I'm going to give you guys 10 more seconds. Everybody's telling me D. Well, let us see what the answer is. And the answer is fast track clinic. The fast track clinic All right, so fast track clinic, which is the ambulatory or fast track clinic deals with relatively stable patients. The decision on whether or not to delegate or assign is based upon the RN's judgment concerning the condition of the patient, the competence of all the members of the nurse care team or the nursing team, and the degree of the supervision that will be required of the RN if a task is to be delegated, right? So shout out to everybody that got that question right. Remember, if you got it wrong, circle back and understand why you got it wrong. This is why we RTFR. It says, wow, I thought that, but I was quite unsure. Kim, I've told you many, many times, and I'm going to tell you again, go with your gut answer. Go with your gut answer. 9 times out of 10, your very first answer is your correct answer. You have the confidence. You have the confidence to make the correct decision. All right. Make the decision, run with it. And if you know it's your gut feeling, it's going to be right. And even if it's wrong, you learn from that. Even if it's wrong, you learn from that. And I would rather you learn it here than go to the test and get it wrong. And then worse, go work in somebody's hospital, right? And then also do it wrong. And then you hurt yourself or you hurt your patient. All right. That's what we don't want. All right, here we go. Question number 7. A client with multiple injuries is rushed to the ED after a head-on car collision. Which assessment finding takes priority? So what takes priority? Which one of these issues is going to cause my patient to die first? Is it an irregular apical pulse? Is it ecchymosis in the flank area, a deviated trachea, or unequal pupils? Tension pneumo, where do you see that? I don't see tension pneumo. What are you insinuating? Everybody got some D's, we got some C's, okay. Kiki says C, okay. I think that was Megan that said something about a tension pneumo. I'm picking up what you're putting down. I know what answer you're referring to. All right, shout out to all 49 of y'all out here rocking. We're doing NCLEX questions. Hey, if you're just now joining, make sure you guys smash that like button, you guys share, and you guys follow. Hey, we are on the road to 10,000 likes. I'm on question number 7. If I don't have 10,000 likes by the time I get to question 10, I promise you, you will get no more questions after this. And I got a whole bunch in here. Hey, Nurse CC in the building. Hey, if you are one of those people that struggle with nursing or dosage calculation, when I tell you a blessed RN, Nurse C, will get you right. She is the dosage calculation queen, and she will get you right. So if y'all aren't following her, what are you doing? Go over there and follow her. All right. And the answer indeed is C, a deviated trachea. All right. It says dumb question. Where is the like button? Oh, you just tap the screen and it gives you the hearts. A deviated trachea is a symptom of tension pneumothorax. So I think that Megan that said that, right? Which will result in respiratory arrest if not managed. The first question in the triage algorithm for triage nurses asks whether the patient requires immediate life-saving interventions or simply, is the patient dying? All right. The nurse determines this by looking to see if the patient has a patent airway, if the patient is breathing, and if the patient has a pulse. Hey, duh, it's all good. Shout out to you, Megan. Shout out to you, Gene. Shout out to all y'all that got that question right. Make sure you guys keep smashing that like button or keep smashing it. Here we go. Question number 8. All right, question number 8. Several people were killed and injured in a recent industrial explosion. The victims are being interviewed and assessed by the nurses for possible psychiatric crises. Which client has the greatest risk for post-traumatic stress disorder? Remember, this is a psychosocial integrity type of question, right? Good therapeutic communication skills, all about safety, right? But then also based off of what's happening, who's going to be the person that's probably going to have it the worst? All right. An individual who was injured and trapped for 8 hours before rescue, a person who saw the death of the coworker during the blast, an individual who recently discovered that her daughter was killed in the accident, or a person who repeatedly watched television coverage of the event. Whoa, hold on. What'd I miss? Somebody pass? Did somebody pass? Oh, yes, Lord. That's what I'm talking about. Is it Marini? It says, I passed my NCLEX on Monday. I received that iPad. That's what I'm talking about. Congratulations to you, Marini. Marani, I'm sorry. Welcome to the greatest shit show on earth, known as being a nurse. If there's a piece of advice that you could give to everybody out here, what would it be? And once again, congratulations to you. Hey, listen, It doesn't matter how many times you take that test, ladies and gentlemen. It does not matter how many times you take that test, because that test does not define you. You define you. If you're a shitbag, you're going to be a shitbag nurse. All right. So if you want to change that narrative, you need to change from within. All right. So the test doesn't determine that. You need basic competency. You need basic competency. Nurses cometh. I know that's right. Hey, like I said, if y'all ain't following this young lady right here, a blessed RN, because indeed she says we are all blessed RNs to be working out here, y'all are doing it wrong. Y'all need to go following her. All right, here we go. So any of these victims may need or require psychiatric counseling. There will be changes in previous coping skills and support groups. Nevertheless, the individual who encounters a threat or to his or her life is at the greatest chance of having psychiatric difficulties following a disaster incident. All right, so shout out to everybody that got that question right. We are on to the next question. And by the way, if you don't get it right, make sure you circle back and you look at disaster planning, right? And then look at psychosocial integrity. That's where you know you need to hone it in on, all right? All right, I already see it. It's a select all that apply question. Let me tell you something right now. When you guys get those case studies, you will have them. You will have them, okay? Don't stray away from them. And here's my biggest thing. If you don't know, don't pick it. All right. Question number 9. When several areas of a daycare center collapsed due to an earthquake, like in New York, I'm just kidding, children, especially injured ones, were brought to the ED. As a competent nurse, because that's what everybody is here, you know that children will be more predisposed to which of the following? Select all that apply. Is it bradycardia, fracture to the long bone, head trauma, hypothermia, hypoxemia, junctional arrhythmias, liver and spleen contusions, or lumbar spine injuries? Them good old Satan questions. Y'all love them. Y'all love these questions. Stop playing. What do we think it is? It says, hey, Kevin, I passed my NCLEX PM. I found out this Monday. I think your lives really do help. Thank you. You're well. First of all, yada, 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 yada. Hey, let me tell you something right now. First of all, congratulations to you. Welcome to the greatest shit show on earth, known as being a nurse, whether you are an RN or an LPN, because it says nurse in the name, and you hold a license. If there's a piece of advice you can give to anybody out here, ma'am, what would it be? And once again, congratulations to you. Don't tell me that you think these lives work. Tell me that you know they work, because you were here participating. Let everybody else know that any live that I put on is going to work. Just like the 3-day live that I'm going to be doing this weekend. And if you're interested in that, make sure you check that link in my bio or go to thebootnurse.com/3-day review. All right, let us see what the answer is. It says, never second guess yourself, believe you can do it. Absolutely. Congratulations to you. It says lives they do be working. Let them know, CC. All right, here we go. And the answer is C, D, E, and G. C, D, E, and G. All right. C, D, E, G. All right. So we can read them. Let's read them. It says they have proportionally larger heads that predispose them to head injuries or trauma. That's true. Hypothermia is more likely due to their thin or skin and proportionally large body surface areas. For E, hypoxemia is more likely because of their higher oxygen demand, so for neonates, infants, and children. And for G, liver and spleen injuries are more likely due to the thoracic cage of children, giving less protection. Don't second guess yourself is number one thing. You know more than you believe. Hey, listen, let them know. Let them know. For those that are so uncertain of themselves and their ability to pass this exam, trust and believe me, you can pass this exam. All right. Ladies and gentlemen, question number 10. What is regarded as one of the priority actions that must be accomplished when a primary assessment of a trauma client is conveyed? All right. So what is the priority action when you're doing a priority assessment on a trauma patient? All right. Taking a full set of vital signs, completing a brief neurological assessment, monitoring pulse ox reading, or palpating and auscultating the abdomen. What are we thinking? 3 or 4? That's okay. Remember, select all that apply, partial credit. So you get 3 out of the 4 points, right? And listen, ladies and gentlemen, if you guys don't know about me, my name is Kevin. I've been an RN almost 4 years, bachelor's degree RN, if that really matters to you. I was 16 years in the Navy. 9 of those years, I was a master instructor. I just got out of the Navy in January, and I failed my NCLEX 3 times, ladies and gentlemen. I failed my NCLEX 3 times. And let me tell you something right now. Nobody cares. You are the reason why you fail. You are the reason why you will not be successful. So guess what? Be the reason why you are successful. Get out of your own way. You know why I tell you that? It's because I failed. But you know, the one thing I didn't do is I didn't quit. So I ask you, how bad do you want this? How bad do you want to be a nurse? How bad do you want to have the privilege? Because it is a privilege. It is not a right. How bad do you want the privilege to take care of somebody else's parent, their child, their grandma, their grandpa? What do you want to do? You're going to put in the work, or are you going to give up? Because if you give up, let me tell you something right now. If you could very easily give up on yourself, you'll easily give up on your patient. So if you're not the one to give up on yourself, look, this is what this is all about. This is what this is all about. All right, here we go. Let's see what this answer is. I have to control my anxiety. Yeah, that's the first thing you need to do. And the best way to control your anxiety is to put yourself in those situations. Recreate your testing center. If you create the testing center and you know thy enemy, it's not going to be a surprise when you get there. It says giving up is not an option. I know that's right. But the answer is B, completing a brief neurological assessment. A brief neurologic assessment to ascertain level of consciousness and pupil reaction is part of the primary survey. Once the patient is stabilized, a neurological examination should be conducted. CT scan is the diagnostic modality of choice in the initial evaluation of patients with head trauma. All right, so shout out to everybody that got that question right. Hey, I need to know neurologically. Hey, can you hear me? Hey, what brings you in today? Oh, okay, so now it's telling me neurologically we're having an issue. Right? So, hey, I need to get a CT scan to make sure that I don't have a brain bleed or anything like that. All right. So shout out to everybody that got that question right. Remember, these are management of care questions. And if you're going for the LPN exam, these are what they call the coordinated care. Still the largest section on the NCLEX, okay? For both RNs and LPNs. But ladies and gentlemen, of course, I got some free test taking tips that are over there on my link in my bio, or you can go to thebootnurse.com/test. I got an ebook over 700 pages. We have management and delegation questions. We have EKG interpretation, pharmacology, growth and development, you name it. It's over there to get you over that hump. But if you want something a little bit more in depth on top of giving you some videos, you can join the 7-day NCLEX course plus a community where I do live lectures and live question breakdown in there as well. But I go a lot more in depth. And if you're one of those people who can't control your anxiety, or you don't know where to start, you don't understand NCLEX style questions, you don't know how to apply the content to questions, you don't have a good schedule, like you want to be held accountable, come check me out, bootnurse.com/coaching, and I'll get you right. Listen, I have 100% pass rate for coaching people. 100%. Everybody that I coach, they pass. Last one I just had pass was on the 29th. I have another young lady taking hers tomorrow, and then another one taking hers next week. Like, that's what we breed winners out here. Winners that are going to go out there and take care of somebody's family. All right. And that's what I want. I want to make sure that you understand what you are doing. Question number 11. Prior to oral defense, a 21-year-old nursing student goes straight to the clinic due to tingling sensation, palpation, and chest tightness. Deep, rapid breathing and carpal spasms are also observed. What is the nursing diagnosis? What is the nursing priority action for this situation? All right. So is it give oxygen, allow the student to breathe into a paper bag, report to the physician immediately, or give an order for an oxylytic medication? Man, my dyslexia is all over the place today. Let me tell you. Hey, if you guys are just now joining, welcome, welcome. We are doing NCLEX questions. I got them off nurseslabs.com. They are free sets of questions. You guys can go over there and check them out. Also, I am doing a 3-day live review starting on Friday at noon, Friday, Saturday, and Sunday. We're going to tell an NCLEX story, and I'm going to tell you everything that you need to know in order for you to conquer the NCLEX on all 3 days. All right. Ray of Sunshine said I take my NCLEX on the 18th. Shout out to you, Ray. All right. And if you guys want to be a part of that 3-day review, hey, listen, you get the live replay, you get my NCLEX victory guide, you get 90-day access to the NCLEX course as well as the community. So if that's something that you want to be a part of, check that link out. And that link is also in my bio. But let us see what the answer is in 3, 2. And the answer is B. Who said that? Nikki Joe. It says 26th year of nursing in the house. I love to quiz my knowledge. 26 years. Where? Didn't I say that last time? Where you were like, I've been a nurse for 26 years, and I told you I still didn't believe you. Because you don't look like you've been in there for 26 years. I'm giving you a compliment, ma'am, saying that you look young. That's all I'm saying. That's it. But shout out to you. But the answer is B. Allow the student to breathe into a paper bag. Now, whether you believe this or not, this is what the question asked for you. Yes, I'm 50. What? Stop it. Cece, thank you for the rose. I appreciate you. So a student is hyperventilating secondary to anxiety, and breathing into a paper bag will provide rebreathing of carbon dioxide, right? Encouraging slow breathing will also help. The idea behind breathing into a paper bag or mask is that rebreathing exhaled air helps the body put CO2 back into the blood, all right? And that is the whole point. That is the whole point. You hear people say that, hey, they don't do that anymore. Hey, NCLEX will still ask you questions like that. They will still ask you questions like that. You see what I'm saying? So here's the thing. Don't take my word for it. If you really want to know, go back and look at your content. Go open up that MedSurg book. That book, that's exactly where NCLEX pulls their questions from, by the way. Just letting you know. That's where the basis of their question starts, is the MedSurg book. So if you got it wrong, circle back, get the content, and keep tackling questions. That is what you need, because that's what the NCLEX is. All right, here we go. Question number 12. The nurse is assigned to a small rural community hospital. 6 clients have arrived at the ED because the local church is caught on fire. More affected residents are expected to arrive soon, and is the only hospital in the nearby area. Now, I want you to arrange the following 6 clients in order in which they should obtain medical attention utilizing disaster triage principles. So remember, triage, which is French for sort, is we need our green tags, our yellow tags, our red tags, and our black tags. All right. Well, we're going to put them in order based off of who's going to be seen first. All right. So I'll give you guys a minute. I had some chicken cutlets last night, and it was fire. I'm just letting y'all know. I'm trying not to smack over here because it's rude. Hey, if you guys are just now joining, we are doing NCLEX questions. These questions are from nurseslabs.com. They are free sets of questions. You guys can go over there and check those out for yourself. Make sure you guys smash that like button. You guys share and you guys follow. We are on the road to 20,000 likes. We're on the road to 20,000 likes. So whenever you guys decide to get untired and uncarpal tunneled, I need for you to get tired with carpal tunnel. All right. All right. I'll give you guys 15 more seconds. What are we thinking? Did y'all just give up on me? I hope not. Jenny, welcome. It says ECBFA, ECEDBA. Okay. Oh, wait, no. FCEDBA. Okay. May. What else are we thinking? What else are we thinking? Ooh, y'all are quiet today on this Wednesday. All right, let's see what the answer is. Okay. Is it Rajal? Regale? You gotta let me know. Gotta educate me on how to pronounce your name. Got FEBCD, ECFABD, CDBFEA for Gene. And for Man, it's CEFB. Rejay. Is it Rejay? Rejay. All right, cool. Hopefully I said it right, but let's see what the answer is. And the answer is C, E, B, D, F, A. Ooh. Oh, hold on. Oh, man. Some of y'all got them mixed up. That's okay, though. That is okay, though. Because, hey, now we're about to understand why. So it's the 11-year-old may die if the nurse consumes too much of the time attempting to control the fire. First, initiate an albuterol treatment to the 11-year-old for asthma. This action is quick to perform, and the child or significant other may be instructed to hold the apparatus while the nurse attends to other clients. All right. Second one is the firefighter is at greatest risk Then it says the next to attend to is the 19-year-old with a crushing injury. 4 is to take care of the grandmother with burns to the forearms next by providing dressing and pain management, as well as give comfort measures to the child with burns more than 70% of the anterior body. However, the prognosis is very poor. And then for 6, it says the prognosis of the client in cardiac arrest is very low, and the CPR attempts have been held. Remember, if they're black tag, we don't use any resources on them. We don't use any resources on them. So it's like if they were like 90 or 100% of their body burned, if they're not breathing, if they have brain matter that is exposed, if they have unequal pupils, we don't use resources on them because the likelihood of them being alive is very, very low. Right? So just think about that. If you got that wrong, it's okay. Circle back, understand triage and understanding who's going to be emergent and who's going to be seen first. Those red tags, those are the people that we want to see. Remember, life, limb, eyesight. Those are huge, huge things to remember when it comes to disaster planning, okay? Not just disaster planning, but triaging, all right? All right, first of all, I do not remember having all these in here. I do not like that at all. All right, we're going to this one. All right, here we go. Question 14. A group of passengers enter the ED with complaints of cough, tightness in the throat, and extreme periorbital swelling. There is a strong odor from their clothes. They report exposure to a gas bomb that was placed in the bus terminal. What is the priority action? What is the first thing? What is the very first thing that I want to do? All right. What takes priority? What do I do? Readily transfer clients and visitors from the area, check vitals and auscultate lung sounds, assist clients in the decon area, or direct clients to the cold or clean area for immediate treatment. What are we thinking? Priority can be first or it could be best. What is the best thing that we do in this situation? What is the first thing that we do in this situation? Because they're in the emergency department and they're exposed to all of this stuff. So now if they're in the emergency department exposed to all of this stuff, they're exposing everyone else. All right. So what would be the priority action that I do? Shout out to everybody that's just now joining. We are doing NCLEX questions. I got them off of nurseslabs.com. Megan says safety. Okay. Got them off nurseslabs.com. They are free sets of questions. We're on the road to 20,000 likes. So make sure y'all smash that like button. All right. Shout out to everybody that's about to be finishing up their semesters, and graduation's right around the corner. Graduation is right around the corner for all of y'all that are almost ready. Jenny's telling me C. Quant is telling me C. Okay. Is it Amilu? Amilu is telling me C. Well, let's see what the answer is in 3, 2. And the answer indeed is C. Assist clients in the decontamination area. Kiki said that graduate May 10th. That's what I'm talking about. Hey, tell me that, hey, I don't want anybody in here to tell me that they hope to pass anything. You better tell me that you will pass it. All right. Hope is for people that don't have a plan and for anybody in the Star Wars universe. We don't do that around here. All right. So decontamination in a specified area is the priority. The decontamination and support areas are established within the warm zone, also referred to as the contamination reduction zone. Decontamination involves thorough washing to remove contaminants. All right. So that is, hey, we got to get all the nastiness off because we can't have we can't have these people exposing all these other people in the hospital, because now you're going to have 5 people and then you could inadvertently end up with 50 people, right, who got exposed to that same exact thing. And we don't want that. OK, so if you answered wrong, make sure you go back, you read your rationales and you understand why you got it wrong. Remember, if you guys know my 3 sayings, RTFQ, RTFA, RTFR. If you don't know what those are, if you're a frequent flyer in my chat, y'all let them know what's up. All right. All right, here we go. Question number 15. A drunk driver has been in the police station for 48 hours. During the first hours, he had tremors and was feeling anxious and sweaty. Currently, he is experiencing a disorientation, hallucination, and hyperactivity. It was noted that the client has a history of alcohol abuse. He has alcohol abuse. What is the priority nursing diagnosis? All right, so is it risk for nutritional deficit related to chronic alcohol abuse, risk for injury related to seizures, risk for situational low self-esteem related to police custody, or is it risk for other directed violence related to hallucinations? What are we thinking? All right, got some folks telling me D. Got some folks telling me D. Now, I want you to read this question. RTFQ. RTFQ, read the question. Y'all tell me. Read the question. He's displaying he's been a drunk driver for 48 hours. His first hours, he had tremors and anxiety and sweats. And now he has a complete altered mental status, right? What comes after like 48 hours, he's gotten worse. So what is he displaying? That's how you have to think to yourself. What is he displaying? Okay. If you understand what he's displaying, you know what signs and what symptoms that we look out from that. Is he experiencing withdrawals after 2 days? Because the withdrawals consist of the tremors, the anxiety, the anxiousness, and the sweats. However, disorientation, hallucinations, and hyperactivity tells me something a little different, right? Tells me something a little different. He's at risk for increased seizures. All right. And like you said, somebody said D for safety. There you go, Geraldine. It's B. All right. It is B, risk for injury related to seizures, because he is going into delirium tremens, DTs. Right, DTs, you start to have hallucinations, you start to be disoriented, right? Because you're deficient of the vitamin B1, the B1 thiamine, right? So alcohol withdrawal 48 hours, 72 is 72. So it's 72 hours, 48 hours. You see different things. I personally have seen different things in the books. However, the timing is not what I was looking at. It was the fact of how after an hour, he potentially got worse. You see what I'm saying? So client safety is the priority because the driver exhibits neurological hyperactivity and is on the verge of a seizure. Medications such as Librium are needed to decrease neurological irritability, and Dilantin for seizures. Thiamine and Haldol may also be ordered to treat other problems. All right. So granted, we saw the 48 hours there. However, and you said 48 to 72 hours. So we're at the threshold of 48 hours, right? But although we're at the threshold of the 48 hours, he is still deteriorating because now he's disoriented. He wasn't disoriented at the beginning because now you're showing that his prognosis is getting worse. Okay. Says I got it right. Just how I worked it. I thought I get. No, it's all good. It's all good, Megan. It's all good. Because remember, you have to apply your critical thinking in order for you to make a clinical judgment, a good, safe clinical judgment. Okay. And that's what it's about. All right. So make sure you circle back and you understand and you look up like alcohol withdrawals, delirium tremens. Just make sure you get a good understanding of it. All right. I personally, when I worked ICU, I swear I saw so many alcohol withdrawals and DTs. It was just like they were giving them to me on purpose, or they come in waves. It's kind of weird. But ladies and gentlemen, real quick, hey, I got some free test taking tips you guys can go over there and check out. 42 pages on a PDF that you guys can check out to help you conquer the NCLEX. You guys should check it out. thebootnurse.com/test. If you're looking for an ebook that can help you, 700 pages to include, but not limited to, EKG interpretations, pharmacology, growth and development, management of care, delegation and supervision type of questions. You guys can check that out as well. The NCLEX, thebootnurse.com/victory. If you're looking for something that's a little bit more visual for you, where I go over lectures, you guys can check out the 7-day NCLEX course. You can join it for $7. You can join it for $7 for 7 days. That's the trial. After 7 days, it goes to $97 a month. All right. And if you're one of those people who needs and requires help on NCLEX, you failed it multiple times, you don't know where to start, you don't understand NCLEX style questions or content, you have no accountability, you lack time management, and you want me to rope you in and get rid of all the fluff, we can do that. You can check me out at thebootnurse.com/coaching. Fill that questionnaire out and come holler at me. Let's see what's up. All right, here we go. Question number 16. During a class discussion, the 50-year-old professor suddenly feels left-sided chest pain, dizziness, and diaphoresis. What is the priority action when he arrives to the emergency department triage area? Do I want to supply oxygen via nasal cannula, place IV access, notify the ED physician, or set the client on continuous electrocardiographic monitoring? I really enjoyed it. The challenges and Content Cafe were very educational. Oh, May, I appreciate that. I appreciate that. I appreciate that because I enjoyed putting those together. And after the last one gets finished, I'm going to recycle and put some more questions on there. All right. The challenges are pretty cool. I enjoy those. So we got D, B, D, A. T Lynn or Lynn, I'm just going to call you Lynn. Thank you for what was that? For the heart earlier. I saw that. Probable STEMI, probable, maybe, right? So what do we think it is? So what is the very first thing that I want to do? All right. He has dizziness and they have diaphoresis, right? So what do we think? I have some people saying B. I have some people saying A. I have some people saying D. Okay, priority, first thing. What's the very first thing I want to do? O2, then ECG. Oh, okay, Gene, I see you. And the answer indeed is oxygen. Supply oxygen via nasal cannula. Increasing myocardial oxygenation is the priority goal. One of the primary signs that's a left-sided chest pain, right? Right. So that's a classic sign that somebody's having an MI, right? So place the client on the cardiac monitor, establish IV access, and then give 162 milligrams to 325 milligrams of chewable aspirin, clopidogrel, or ticagrelor, unless bypass surgery is imminent. Control pain and consider oxygen therapy. But yet you want to give oxygen first, right? You'll hear people say Mona, morphine, or pain meds first. Just because it says Mona doesn't mean we go in that direction. And by that direction, it doesn't mean that we give oxygen before pain meds or pain meds before oxygen. You just need to know what they are and then what is displayed to you in the question and then how you deliver whatever Mona stands for. All right. So remember that. And if you don't understand myocardial infarctions, one. Yeah, some people call it Mona. I've heard one. I've heard both. It doesn't really necessarily matter, but as long as you know what to do. And it's funny because I actually created I have a video inside a lecture video inside the 7-day NCLEX course. It's called Myocardial Infarction, where I talk about STEMIs and NSTEMIs. It's like a 20-minute long video where I give you everything that you need. So if you're a part of that, make sure you guys check that out in the 7-day NCLEX course. All right, here we go. Question 17, a child with fever has been admitted to the ED for several hours. Cooling measures are ordered by the physician in order for the client's temperature to come down. Which task would be appropriate to delegate to the nursing assistant? All right, so we're back to delegation, supervision, and assignment. Who can do what? What can the UAP do? That's who the UAP is the nursing assistant. All right, what is their scope of practice? So is it A, they can a UAP or a nursing assistant prepare and administer a tepid bed? Can they assist a child in removing outer garments? Can they educate the need for giving cool fluids? Or can they tell the parent to use acetaminophen, Tylenol, instead of aspirin? That's how I want you to read it. That is how I want for you to read it. All right, what can they do? Megan, every time I see your name, I just want to be like, Megan, your jacket, but you don't have an E. You don't have an E in your name, so I can't do it. Shout out to all 52 of y'all rocking. We're doing NCLEX questions. Got them off nurseslabs.com. They are free sets of questions. Make sure you guys go over there and check that out for yourself. Is it your Kenyan angel? I swear you look like this girl I went to school with. I swear you look like this girl I went to school with. Her name was English, and I swear you look exactly like her. Nikita says B. Also, I want to know who you are, where you're from, and where you're at in your nursing journey. And if you're not a nurse, what are you doing here rocking with us? What are you doing here rocking with us? But the answer is B. Assist the child in removing outer garments. Good job, Robin. Wait, Robin, did you get that right? Let me see. Robin, if you didn't, okay, cool. You got it right. I can't be giving you your props if you didn't get it right. What kind of person do I look like? Kate, what's up? What's up? Hey, anybody in here trying to learn their paramedic lives, go holler at my girl, Kate. Kate, hey, give me the 15,000 likes. People over here get tired. The nursing assistant can assist with the elimination of outer garments, which enables the heat to dissipate from the child's skin. The nurse who delegates aspects of care to other members of the nursing care team must balance the needs of the client with the ability of those to which the nurse is delegating the task and aspects of care, among other things, such as scope of practice and the policies and procedures within the particular healthcare facility. All right, that's a management of care question. Dealing with delegation, supervision, and assignment, giving that task to the UAP for them to do because it fits within their scope of practice. Somebody said, I failed NCLEX 3 times. I need help. Hey, if you need help, go check. I have all types of stuff that can help you. But if you failed 3 times, I'm one of those people that says, hey, come talk to me. So I would recommend go looking the link in my bio. It's labeled the NCLEX coaching and mentoring. Make sure check that out. Fill out the questionnaire. Schedule a call and come talk to me. Schedule a call and come talk to me. Last term VN exit on the 26th of April. Oh, okay, that's right around the corner. Right around the corner. Is it Rejay? Rejay. Can I just call you Riri? Can I call you Reg? Mostly it's because I'm illiterate. Here we go. Question 18. A traveler's feet suddenly become pale, turn red, and feel very cold. In just 30 minutes, the affected part becomes prickly and numb. Now, place the following interventions in the correct order for a client with frostbite. So what order is this going to be? Am I going to administer pain meds first? Remove the client from the cold area. Monitor for compartment syndrome. Immerse the feet in warm water of 105 to 115 degrees Fahrenheit, or apply loosely sterile bulky dressing. So what order are we going to put these in? Okay, Robin, did you read it before I finished? My goodness. Bad EC. Okay, Robin. Wait, never mind. Oh, okay, here we go. Here we go, Robin. Let's get it together. Let's get it together. Jackie Chan, stop it. BCDAE. Shout out to you, Mr. Chan. Gene says B, A, C, and E. Okay. What else we got? Not Amber. Don't come in here making that face. Don't do that to me. You're supposed to be my ride or die on my side. We're sidekicks with one another. You guys to help me, okay? Hey, if you guys are not following Nurse Amber, aka Nurse Glamber, another NCLEX strategist, a homie, and a ride or die, if you guys are not following her, what are y'all doing? Y'all need to go over there and need to follow her. She also has a free workshop coming up. What is it, on the 3rd? What is it, on the 3rd of May? I think it is, right? So if you guys are not following Nurse Glamber, what are you really doing? Go follow her. She'll get you right. She is the good cop to the bad cop, and I'm the bad cop. All right, let us see what the answer is, ladies and gentlemen. 16th, the free workshop. Got it. 16th, the free workshop. Make sure you guys go over there and check her out. All right. And that is on Tuesday. What is that on? Yep. Yeah, that's on Tuesday. Okay. So here we go. And the answer is B. It is. Oh, man. Look at that. Look, Robin, did you change your answer? I'm going back and I'm looking right now because if Robin changed her answer. Yeah, Robin, you had it right the first time. Oh, man. Robin said, never mind. So you can't know. Yes, it's in my head. No, you changed it. So it's BADEC. So Robin got it wrong. Initially, the client should be removed from the cold environment. Pain medication should be given before immersing the feet in warm water to lessen the discomfort. The client should be monitored for compartment syndrome every hour after the initial treatment. All right. So shout out to everybody that got that right, except for Robin, because she got it wrong. No, I'm just playing. But hey, remember, I would rather you get it wrong here and you go and you look through them. You guessed right. Look at that. You see what happens when even if you guess it right. You truly remember, on NCLEX, you're not meant to know everything. You just need to know what everybody else knows. You know, you need to know what everybody else knows and apply what you know versus trying to apply what you don't know. All right. And some people say it's common sense, but common sense isn't all that common. I do that too, Robin. We got to stop second guessing. Yes, you have to stop second guessing yourselves. You guys got it. I use common sense. Lynn, well, common sense isn't always common with people. And you got to realize that, like, a lot of people, they second guess themselves a lot because they're just like, wait, are they tricking me? No, I'm not tricking you. Not tricking you. NCLEX will be very straightforward, all right? And take it for somebody who has taken the exam 4 times. It will be very straightforward. Second guessing will make or break your exam. Indeed, yes, it will. Yes, it will. So go with your first gut answer. Always, 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 okay? Unless you can 100% articulate to me why it is not the answer, you better not change it, all right? Hear my voice. Hear it. It says, no, it's not. It says, no, it's not. I used to second guess myself. So you're right. Absolutely. It says, you know more than you think. Go with the first nursing instinct. Absolutely. Question 19. An elderly maintenance staff is lying on the floor and the ED nurse responds to a call for help. So I want you to put these in order for what task the nurse must carry out first. So from first to last, instruct the nursing assistant to get your crash cart, call for help and activate the code team, initiate CPR, perform the head tilt chin lift or jaw thrust maneuver, or establish unresponsiveness. So from first to last, what are we doing? From first to last, what are we doing? Shout out to everybody just now joining. We are doing NCLEX questions. If you guys have not followed, liked, or shared, what are you really doing with your life? I'm trying to get to 20,000 likes, but apparently people be tired out here. So, but I appreciate everybody being here. All right. Make sure you guys follow and turn on that notification button on, because I go live every Monday, Wednesday, Friday at 5:30 religiously. Next week, probably not though. So Friday will probably be the last day if I decide to do it Friday. All right. So of course I want to know who you are, where you're from, and where you're at in your nursing journey. Got E, B, A, D, and C. Okay. Wait, what did Robin put? Because now I'm fixated on you. E, B, A, D, and C. Okay. E, B, A, D, C. Okay. Is it Rose? Riri says E, C, B, A, D. Okay. E, C, B, A, D. Okay, cool. Let's see what the answer is. The answer is E, B, C, or E, B, D, C, A. E, B, D, C, and A. First, we want to establish responsiveness. Hey, Mr. Jackie Chan, can you hear me? Oh, okay, cool. Mr. Jackie Chan, can you hear me? Oh, Mr. Jackie Chan is unresponsive. All right. Oh, he can hear me. Cool. Never mind. All right, cool. So I established responsiveness, right, with Mr. Jackie Chan, right? And so I want to get help and I want to call the team if the patient is unresponsive, right? So every room has a code blue button, or scream, help, right? And then I want to open up that airway doing the chin lift or the modified jaw thrust, right? Usually if it's a witness fall, depending on how they fell will depend on what you do. You're never wrong if you do the jaw thrust. Oh my gosh, that's right. E first. There you go. Look, come on, Lynn, come on. All right, then you want to do CPR. All right, and CPR should not be interrupted. Remember, CPR goes off of it goes off of 5 cycles, right? And then when you get more help in there, the code team, they're going to start taking over. Where CPR never stops. It never stops unless you get that AED attached and then recognizes that there's a rhythm, continue CPR. All right. And then a crash cart. That's when the code team arrives and the code team is going to do their thing. As somebody who has been a part of many, many codes, there's going to be tons of people in there. All right. So, but you need to understand what you can do and what you need to do before they get there. You can't rely on the code team to be there. It could take them an additional 60 seconds to get there. 60 seconds that you don't have. All right. First assess. There you go. Nursing process. Add pi. First assess. Mr. Jackie Chan, can you hear me? And he's just like, yes, sir, I can hear you. All right. So shout out to everybody that got that question right. Remember, circle back. If there's things that you don't understand, circle back so you guys can understand why these answers are the way that they are. And by the way, some of these questions you may not like. And some of them, honestly, may be omitted and they may be wrong. But if I give you 100 questions and there's 5 of them that are omitted, it still doesn't give you free reign to just do terrible on an exam or blame the exam. OK, there's still great caliber questions that are out there. OK, so question number 20, which task is most appropriate to assign to the nursing assistant when an instantaneous death transpires in the emergency department? Assist with postmortem care, escort the family to a place of privacy, going with the organ donor specialist to talk with the family, or helping the family to collect belongings. What are we thinking? And by the way, instantaneous deaths can happen anywhere, not just the ER, but they happen mostly in the ER because, you get traumatic patients that come in. All right, we got D. Now think about it. All right. We're talking about the UAP, the nursing assistant, the unlicensed assistive personnel. All right. What is within their scope of practice? Right. Remember, they don't have a license like an LPN or like the RN does. Right. Although the RN is ultimately responsible, what can they do? What can the UAPs do? We got D, we got B, we got A, got a D on here. All right. Caramel, says B. Okay. Monica? No, Monica. I'm sorry. What's up, Nope, not going to do it. Monica says B. All right, but the answer is A. I'm sorry, but the answer is A. I'm laughing at Monica's name, and I'm laughing just because I'm immature. Here we go. So postmortem care demands some turning, cleaning, lifting, and so on. And the nursing assistant is equipped and authorized to assist with these responsibilities. All right. The use of an NAP, which is a nursing assistant personnel, increasingly demands registered nurses to delegate patient care tasks according to the principles of the ANA. All right, these principles define nursing delegation as the transfer of responsibilities for the performance of an activity for one individual to another while retaining accountability for the outcome. So I as a registered nurse, will give the UAP the task. As a matter of fact, me and the UAP, the nursing assistant, are going to do postmortem care together. Because that's just me, but we're going to do that together because it does require the cleaning and the tidying up of a dying or dead patient. And that is very much within their scope of practice to assist. Keyword is assisting with postmortem care. Assisting with postmortem care. All right. So shout out to everybody that got that right. If you got it wrong, understand why you got it wrong. This is why we RTFR. And if you guys don't know what RTFR stands for, it stands for read the fucking question. Yeah, I said the F word. You're going to have a hard time being a nurse if you don't like the F word. However, to each their own. But RTFR, read the fucking rationale. All right. I want you to take a guess on what RTFQ and RTFA stands for. All right. So shout out to everybody that got that right. If you got it wrong, circle back, get the content, make sure you have a great understanding. Rather you get it wrong here than get it wrong somewhere else. Ladies and gentlemen, lastly, what I would like to say is that I am putting on an NCLEX review, both for RNs and LPNs. And yes, repeat test takers. Is happening on April 12th to April 14th. We're starting at noon on April 12th to 5. April 13th and 14th, it will be 9 to 5. You will get a 3-day lecture. We're going to break down new generation NCLEX style questions. We're going to give you test taking strategies. You're going to get my ebook. You're going to get 90-day access to the 7-day NCLEX course. And I'm working on something special. I'm working on a little something special for the people that are already in. So get in because I'm going to close it here soon. So make sure you guys get into that. All right. And a lot of people are going to ask me the price. The price is at the website, but the price is $197. And you get the live replays. So you're going to have access to the live replays. You get the on-demand course that also comes with content, as well as you get live stuff that goes on inside the community. All right. You have clinicals on Friday. Even if you have clinicals on Friday, if you miss it, you get the live replay. You get the live replay. So if you miss it on Friday, but you can attend for Saturday and Sunday, cool. You'll see it, but you'll still have access to it. All right. But it's just that I'm going to be doing it live with my melanated face. All right. So make sure you guys go over there and check that out. thebootnurse.com/3-day review. You can also find it in the link in my bio. But ladies and gentlemen, that wraps up the questions for today. This is what I get for trying to do something different with the font, and it just looks all funky, right? But I appreciate it. Thank you guys for hanging out and participating. All right. I appreciate all the love and all the likes and everything. The gifts, while they are not required, they are greatly appreciated. Trust and believe me. All right. Like I said, I'm doing that 3-day NCLEX review for RNs, LPNs, as well as repeat test takers for any one of them. Doing that this coming Friday. And I would love to see everybody up in there to get there to learn on and get prepared. Yes, it will prepare you for your NCLEX. And yes, you can take it a week before your NCLEX and it'll get you right. Like I said, you'll have access to it. 7-day NCLEX course in the community. You can join it for $7. $7. One more than 6, one less than 8. You do it, have it for a week. If you don't like it, unsubscribe. But if you stay subscribed, it's $97 a month. All right. And then, of course, if you need one-on-one coaching, my man, Jackie Chan, I appreciate you. No problem, man. And if you need one-on-one coaching for the NCLEX, failed it multiple times, don't know where to start, don't have accountability, don't understand questions, don't understand content, or even how to apply them, check me out. I do one-on-one coaching. I have a 100% pass rate. 100%. All right. So if you want to be a part of that, make sure you guys go over to thebootnurse.com/coaching. But what I'm going to do is I'm essentially going to kind of open it up. You know what I'm saying? I'm going to open it up for some Q&A real quick. Before I get off. But what's up, everybody? How are y'all doing? Shout out to all 38 of y'all are rocking. If you guys are just now joining the live, we just finished with NCLEX questions. I actually did case studies on Monday. People seem to kind of like that. So I may be doing that a little bit in the future. But what's up? What's up? My name is Kevin. Been a nurse for almost 4 years. I was in the Navy for 16. I was on 2 deployments. A lot of people ask me if I've ever been on deployment. Yes, I was on 2. I was in Guantanamo Bay, and I was in Afghanistan. It was 2008, 2009, and then Afghanistan 2012, 2013. I was a surge tech then. Then I became a surge tech instructor after that, and I've been an instructor ever since. Became a master instructor in the Navy as well. So and also I failed the NCLEX 3 times. 3 times, right? And let me tell you something. This test does not determine the type of nurse that you're going to be. Only you can do that. Only you determine the type of nurse that you're going to be. The test does not do that. So what questions do you guys have? I appreciate you guys getting me to 15,000 likes. But what questions do you guys have regarding getting into nursing school, NCLEX, imposter syndrome, working at your first job? Like what questions do you guys have? What questions do you guys have? Robin says, thank you. You are welcome. Kiki says, thank you. You are welcome. Rose and Rachel and Reggie says, thank you. You are welcome. You guys say that? Okay, cool. What else? Hey, if you guys are just now joining, like I said, what questions do you guys have? If you guys don't have any questions, I'm about to go finish this chicken cutlet. You know what I'm saying? What else? Hey, if you guys are just now joining, we just finished doing NCLEX questions. By the way, I do NCLEX questions Monday, Wednesday, Friday at 5:30 Central Standard Time. All right, because I live in the great state of Texas. All right. Hey, how did everybody enjoy that eclipse? How did they enjoy it? I didn't enjoy it. I mean, I did, but I didn't. I was in the path of totality, but it was overcast here, so we didn't even get to see it. And then if we did, it was like a slither in between the clouds. It did get dark here though, and it made me feel kind of weird. So, but what else? What else are we thinking? All right, cool. Well, if nobody has any questions for me, last little shameless plug. Well, it's not shameless because I'm not ashamed of what I'm doing. Make sure you guys check out everything I got going on. Those link trees are in the bio. By the way, if it's not something that you want, that's cool. But send it to somebody else. You never know who might need it, right? And then lastly, make sure you guys go over there and follow me on YouTube, and you follow me on Instagram. And those links are in my bio as well, because we have no idea what's going to happen with good old TikTok, right? And so I'm going to start doing some more stuff over there, but I want you guys to be ready to go. I want you guys to be ready over there just in case something wild happens. All right. So like I said, we did NCLEX questions. I appreciate everybody being a part of that and you guys participating. I may not be back on Friday, and I may not be doing it next week because I'm going to be on a business trip. So we'll see. We'll see how I feel. But I appreciate everybody. If I don't see you guys until next week, I hope everybody has a good, safe next couple of weeks. What's up, Kat? How are you? Kat, what are you about to tell me? Are you about to tell me something? You gonna tell me like you passed an exam or something? What are you about to tell me, Kat? Kat, I'm about to get off. Cammy, oh my God, yes. Yeah, you did pass. Are you working now? Did you change your profile picture? I think that's what it is. You changed your profile picture. And I'm like, who is that? So, but hey, you just caught me as I'm about to go off. So, but yeah, make sure you guys take care of yourselves. There's no California makes it impossible for new grad. Really? Even if you do a residency program? Because I'm curious about that. A lot of people, I've heard that too. It says half my cohort is moving to another state. Might want to do it. California is one of those, is like, yeah, get your license here, but go somewhere else and get experience. Like it's like they will put you through school, but they don't want to train you. They'd rather someone else train you and it not be on their dime in case you mess up, which sounds terrible. So, hey, it could be something to think about. It could be something to very, very well think about. It says, I made it to Kaiser's final interview for the new grad program and wasn't picked. That's terrible. Hey, it may not be a bad idea. I just want to let you know that Texas takes all the new grads. You know what I'm saying? You can come over here and get your learn on and then, go away because you Californians, we don't want you over here. And y'all migrate over here and y'all be destroying stuff. Everyone's moving to Texas. Yeah, you're right. Don't come here. We don't want you here. You stay right where you are. Oh my goodness. But anyways, hey, I really hope that works out. Hey, just DM me if you got any questions about anything. And we'll see if I can see if I know somebody that can not pull some strings, but give you a little bit more avenue to kind of work with in California. Okay. But anyways, like I said, hope everybody has a good rest of their week. And if not, I will see you guys the next time I'm on live, which will either be next week or on Friday. But hey, be ready. Bye.